Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss some interesting things in an interview with paediatrician Anthony Costello, a former director for the World Health Organization, concerning our COVID response and the wider implications for the NHS in general, with his thoughts on how we might come out of the crisis despite government handling of the situation. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So it is possible that you'll have already come across the name Anthony Costello because he's in the Independent Sage group, which I've been following since their inception. Some of you may have as well. In fact, I know from the comments that some of you have been as well. It's really interesting because what they've been doing, because the actual SAGE group, the Scientific Advisory Group for Emergencies, has been full of political appointments, and also their work hasn't been made public in the way that it should be. The Independent SAGE group formed from scientists who have themselves been on SAGE groups and you know, top of their field in other areas as well, to show how these discussions take place publicly so that we can be better informed. And it'll come as no surprise to learn that Costello is not exactly of the opinion that the government has been getting their response right. In fact, quite the reverse. But I was especially interested, well, there's a number of things very, very interesting. I'll put a link in the description below, of course, to the interview. But I was especially interested in what he had to say about the bodies with which the government was driving its response, because it was one thing that I'm very aware of, but it really brought it into sharp focus for me. So Costello had interest into things, you know, to say about the way the COVID data is being managed by different groups, noting that the government's response was to effectively be abolishing Public Health England, and it is true that they have been sidelining the group. Now, make no mistake, the Conservatives already keen to scale up their plans to dismantle the NHS fully before Labour can form another government, and they are using this coronavirus pandemic to accelerate those plans even further. I mean, look at the basics so far. So the government have spent lots of money, lots of money, hundreds of millions, for medical equipment and services like testing, by giving contracts to companies, private companies, that have nothing to do with healthcare, without even putting those contracts up for tender. There is legal action on this, whether that'll get anywhere. I mean, you would think it would, because there are rules to follow and they haven't been following them. But the bottom line is, you've got a situation where we've been getting giving contracts for medical equipment, not to producers of medical equipment, but to people who have nothing to do with it. We've been given an accountancy firm the contract to carry out testing. It makes no sense, you know, and needless to say, has resulted in massive shows of incompetence that you would expect. Of course, if you get an accountancy firm to run a large-scale COVID testing program, which is all fairly new, of course they're going to make a hash of it with the best of intentions without necessarily having idiots in charge. That's not their area of expertise. We should be getting our current healthcare systems to do it. So, but the government, the decision from government is not one of gross stupidity, but of deliberate malice. And they always, you know, the saying is, never ascribe to malice that which may be explained by incompetence. This is malice. This is malice. You know, it's the easiest and most obvious decision in the world for a government. You've got this serious healthcare crisis. Who do we get to deal with it? The NHS, of course. You know, easiest decision in the world to just let the NHS source the equipment that they know they need and the services that they know they need, and for the government to have just provided the funds to do so. It's not even a debate to be had. If, and this is the crux, if you believe in the NHS, that the government have actually removed the NHS and public bodies from our COVID response, means that they believe in abolishing the NHS. If they believed in the NHS, they would have got the NHS to carry out this work. Now, Costello talked about the Joint Biosecurity Centre. You may or may not be familiar with that. I wouldn't blame you if you were not, because it has only been created recently. When I say recently, I mean weeks ago. It was created specifically to work out the alert level. Now, we have this 5-point alert level in the UK. And I suppose I should really say England, because Scotland, Wales and Northern Ireland don't have to take Boris Johnson's lead on this. And the idea is when we were in lockdown at alert level 5. Alert level 4, sorry. Alert level 5 would be really bad. Alert level 5 is, we're all dead. It's poorly defined, but it's very, very serious. Alert level 4 was serious enough for the lockdown. Alert level 3 is when you can come out of lockdown. It all goes... In fact, actually, if you look at what Boris Johnson said about the alert levels when he first announced it, which is an absolute shit show, you would think for the level of easing of the lockdown we've gone to now, we should actually be at alert level 2. But anyway, they say we're at alert level 3. The Joint Biosecurity Centre, its job is to determine the alert level. Now, like I say, it was only recently set up. We know almost nothing about it. We're certainly not privy to the methods that they use to give Boris Johnson the green light to open up the lockdown to the extent he has. So they now say that we're at alert level 3. Interestingly, it was said that we were at alert level 3 before this group had even assembled. Again, no indication as to why this is. You know, the maths was not presented to us on this. So as Costello noted, you know, he said, these are in charge of the data, referring to the Joint Biosecurity Centre. These are in charge of the data and nobody knows who they are or where they're getting it from. The answer, from my point of view, will be obvious enough, I suspect. It's almost certainly a group of Dominic Cummings picks to set the alert level to whatever it needs to be in order to deal with the politics of the pandemic. That way, when it all goes tits up, Boris Johnson will claim he acted according to the scientific advice, as he's already tried to do before, even though we know that's not true. But who will be providing this scientific advice? Because it's not SAGE. In fact, SAGE scientists who initially were going along with what the government was saying, because the government were lying to them anyway, for various reasons, though, they sort of went along with it, and they really shouldn't have done. Now they've actually been abandoned it. They've come out, more of them have come out publicly to say the government are not doing this right. They're not listening to us. SAGE, I don't even know if SAGE, it's sort of, it's a shambles now. There is no reference to SAGE at all in any of the measures. So we'll be saying who's providing this scientific advice, who will we be able to blame, who knows. This nebulous Joint Biosecurity Centre, a name clearly the brainchild of Dominic Cummings. It's the sort of thing he would call the group, whose membership is a complete mystery as well as their methods. And Costello also reminded us that until 7 years ago, testing should have been quite straightforward. You know, we'd have been able to manage regional testing really easily. We were set up for that. But that the Conservative government dismantled the infrastructure that allowed for this. Finally, it was worth noting what he had to say about the prospect of a vaccine. And this is, for me, crucial. Because if you're of the similar mind to me, you may or may not, but you would be fairly certain that we're not going to get out of this mess without a vaccine. Now, there is actually something else on that and a bit of good news towards the end. Better-led countries have been able to control the spread of the virus. They're still going to need a vaccine to make it completely go away, but they have managed to control the spread of the virus. We have not, and I am of the belief that we no longer can do. If Boris Johnson was to have an epiphany tonight and tomorrow to do all the right things, it's impossible. I mean, first of all, he'll still have political opposition within his own party, but also the government have lost the public. So on the subject of the vaccine, Costello said that the good news was that there were more labs trying to develop one than anything else, and there was plenty of money going into it. So it will not be for want of effort if we don't get a suitable vaccine. Then there's the downside. The downside is that the immune response to coronavirus does not really lend itself to effective vaccinations, because the benefit is likely to be short-term only. He alluded to some experts suggesting that 2 years would be a realistic timescale for the development of a suitable vaccine, though he thinks it could possibly be a bit sooner for one that will do the job. Now, obviously we don't know. It's going to be pure speculation. I mean, what we can be fairly sure of is all those right-wing papers like The Express that were boasting that we'll have one for September, this September. we can ignore that. That was not based on anything. My take home from what he was saying is that an optimistic view is going to mean that we have over a year to go for an effective vaccine to become available. And that is assuming that we can get hold of stocks fairly quickly after it becomes available. And then we need to achieve a large uptake, of course. In other words, we are going to be living with this virus with a homicidal lunatic in charge of the response until well into 2021 at least, before a pharmaceutical solution even becomes possible. But there was potential good news as well. So the way I had looked at this, not being an epidemiologist, of course, or any public health expert of any kind, the way I was getting this is it's quite clear that we're not going to get through this with Boris Johnson's handling. And also a vaccine is not possible until well into 2021 at best, barring some miracle. At which point, I am thinking to myself, we are absolutely knackered, aren't we? Completely knackered. What is the data going to look like in a year's time? It's going to be carnage. Maybe not. Because with the modelling of someone called Carl Friston, apparently, there is a suggestion, if the assumptions are true, and it's very important to note that all models are based on assumptions. You define parameters, and then the model gives you some results. If your parameters are correct, then the model will be accurate. If they're not correct, then it won't. There's no way of being sure at the moment. But there are certain assumptions being made which seem at the moment to be reasonable. That it's possible that the crisis could end without a vaccine. That's not to say that the virus would go away as a threat, just that the crisis levels of threat would diminish. Now, what I found odd, though, is that it's based, apparently, on the notion of shielding about half the population. Now, I don't see an adequate... There is shielding, technically, going on, but I don't see that there's an adequate level of shielding on the scale, in the country. Apart from the fact I'm not convinced that the government are telling enough of the right people to shield. Even people who are being told to shield, again, because the government have lost public trust. I know that there are people who are supposed to be shielding and they're told to shield by the government that are not shielding. Because they don't trust the government that it's the right decision. So I don't think it is... I obviously have not read the report. I'm not saying I know better than this modeller. But I am sceptical about the view that we are shielding that many people. But anyway, the model is based on about half being shielded. The idea that, there's going to be a lot of people as well not susceptible. I mean, we know that anyway. There's a lot of people that would not be susceptible to the virus, like the young, very strong immune systems. And there will be others as well who will become infected. You or I may have become infected already without passing it on, because there will be people who will adopt sensible measures as best they can, and therefore, even if they become infected themselves, do not necessarily pass it on to others. Now, they have apparently written to The Lancet about it, which is the journal for doctors in the UK. So I will follow that one up if I can catch hold of it. But in summary, basically, what he's saying is we made a complete dog's dinner of the pandemic response. Yeah. The response has been almost designed to pursue the privatization of our healthcare under cover of COVID. We can't expect a vaccine in time to save us from Boris Johnson, but some modelling might suggest that we can possibly see an end to the crisis without the reliance on a vaccine, even though it will always pose a lower level threat until we get it. In other words, we may not see currently high levels of threat. It may subside. Now, on that last point, I do have mixed feelings politically, because on the one hand, I'm still not sure how many more lives will be lost, even if this outcome that has been modelled is achieved, because I've not read the full reports. That's what I need to read. Or talk to someone who has. In addition, Boris Johnson, if this did happen, would surely claim that it's his measures that worked and the outcome, was down to his measures. In other words, he takes credit when actually he's done the opposite of putting the right measures in place, which of course would give him a political boost. On the other hand, there's no way I'm hoping for a massive second wave just to kill off Boris Johnson's career, because that has a quite monstrous cost. So it's almost a lose-lose situation for me, really. But there it is. On that cheery note, I'll leave it there. I hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.